Imagine this. You've been waking up at 2 in the morning, shaking your hands because your fingers feel like they're wrapped in static electricity. That tingling, that burning in your feet when you stand on the kitchen tile. Cold shouldn't hurt that much, but it does. So, you do what sounds responsible. You walk into the pharmacy, grab a bottle of B12 and maybe some extra vitamin E because somebody at church told you it helps with nerves. You start taking them every single day. And 3 weeks later, the tingling is worse. Not better. Worse, you're confused, you're scared, and nobody warned you that the very vitamins you trusted might be turning against your own nerve fibers. Today, we're going to talk about 3 specific vitamins that millions of seniors take for nerve pain. Vitamins that can actually damage your nerves further if you're not careful about the dose, the form, and the timing. If you stay until the end of this video, you'll know exactly what to watch for, what to ask your doctor, and how to protect yourself starting tonight. Let's slow down for a moment and talk about why this matters so much after the age of 60. Nerve pain, doctors call it neuropathy, affects roughly 20 million Americans, and the majority of them are over 60. Your peripheral nerves, those thin little messenger cables running from your spinal cord all the way out to your fingertips and toes, they become more fragile as you age. The protective coating around them, called the myelin sheath, thins over time the way insulation on old wiring eventually cracks. Diabetes accelerates this. So does poor circulation, certain medications like statins and chemotherapy drugs, and even years of moderate alcohol use that you never thought twice about. So when the burning starts, when the numbness creeps in, when your balance gets shaky because your feet can't feel the floor properly, the instinct is to fix it. And vitamins feel safe. They sit right there on the shelf between the toothpaste and the greeting cards. No prescription needed, no doctor's appointment, no copay. But here's what most people don't realize. Vitamins are chemicals. They are biologically active compounds that change how your cells behave. And when it comes to nerve tissue specifically, the difference between a helpful dose and a harmful dose can be surprisingly narrow. Some vitamins that genuinely support nerve health at one level will poison nerve cells at another level. Some forms of a vitamin absorb completely differently than other forms of that same vitamin. And some vitamins interact with common medications that seniors already take, creating a chain reaction nobody anticipated. This isn't about scaring you away from vitamins, not even close. This is about giving you the precise knowledge to use them wisely so they work for your nerves instead of against them. Let's get into the first one, and honestly, this is the vitamin that shocks people the most. Vitamin B6, also listed on bottles as pyridoxine. Now, if you've done any research on nerve health at all, you've probably seen B6 recommended everywhere. Articles, health blogs, even some doctors mention it in passing. And they're not wrong. At appropriate levels, B6 plays a genuine role in producing neurotransmitters and maintaining the myelin sheath we talked about earlier. Your nerves literally need some B6 to function. Here's where it goes sideways. B6 is one of the very few water-soluble vitamins that can accumulate to toxic levels in nerve tissue. Most water-soluble vitamins, your body flushes out the excess through urine. B6 doesn't behave that neatly. When you take high-dose B6 supplements consistently, and by high dose I'm talking about anything above 50 milligrams per day taken over several weeks, the excess pyridoxine begins binding to proteins inside your dorsal root ganglia. Those are the nerve cell clusters sitting right alongside your spinal cord, the relay stations that process sensation from your arms and legs. When those ganglia get overloaded with B6, they malfunction, and the symptoms look almost identical to the nerve pain you were trying to treat in the first place. Tingling in the hands, burning in the feet, numbness that spreads upward from the toes toward the ankles, difficulty with fine motor tasks like buttoning a shirt or picking up coins from a tabletop. Do you see the trap? You take B6 for nerve pain. The nerve pain gets worse. You assume you need more B6. You increase the dose. The damage deepens. Some people cycle through this for months before anyone catches it. A woman named Dorothy, 73 years old, retired schoolteacher in Ohio, shared her story in a neurology case review published in 2021. She had been taking a B-complex supplement that contained 100 milligrams of B6 per capsule. On top of that, she was eating fortified cereal every morning and drinking a meal replacement shake that also contained added B6. Her total daily intake was somewhere around 170 milligrams. Within 4 months, she could barely walk across her living room without holding the wall. Her neurologist ran a blood panel, found her B6 serum level was 6 times the upper limit, and the nerve conduction study showed significant sensory axonal damage in both legs. When she stopped the supplements, her levels normalized within 2 months, but the nerve damage took over a year to partially recover, and some of the sensation in her left foot never fully returned. The recommended daily amount of B6 for adults over 50 is only 1.7 milligrams. Read that again, 1.7, not 17, not 70, not 100. 1.7 milligrams handles everything your nerves need from this vitamin. So, what should you do? First, flip over every single supplement bottle in your cabinet and check the B6 content. Look for it listed as pyridoxine or pyridoxine hydrochloride. Second, check your fortified foods, cereals, protein bars, nutritional shakes. Many of them sneak in 25 to 50% of your daily B6 per serving without you realizing it. Third, if your current supplement contains more than 10 milligrams of B6 per dose, bring it to your next doctor's appointment and ask whether that level makes sense for your specific situation. Your nerves will thank you for paying attention to this one. Genuinely. Now, before we move to the second vitamin, I want to pause and ask you something. Have you ever taken a vitamin for weeks or months without really checking the dosage on the label? Just trusted that it was fine because it was sold over the counter? Drop a comment below and be honest. I think most of us have done exactly that at some point. There's no shame in it. The supplement industry spends billions of dollars making you feel confident about grabbing that bottle off the shelf. But confidence without information is where problems start, especially when your nerves are already vulnerable. If you're finding this helpful so far, tap that subscribe button. We cover topics like this every week. Real, specific, practical health information for people over 60 who want straight answers without the runaround. All right, vitamin number 2. Vitamin E gets a reputation as a gentle, protective antioxidant. And at standard dietary levels, what you'd get from eating almonds, sunflower seeds, spinach, avocado, that reputation holds up. Vitamin E neutralizes free radicals that would otherwise damage cell membranes, including the membranes of your nerve cells. At normal intake, it's quietly doing good work behind the scenes. The problem begins when people start supplementing with high-dose vitamin E capsules, usually the 400 IU or 1000 IU soft gels that have been popular since the 1990s. Two things happen at those elevated doses that directly affect nerve pain. First, vitamin E is fat-soluble. Unlike B6, which at least partially washes out through urine, excess vitamin E stores itself in your fatty tissues and liver. It accumulates slowly, silently, over weeks and months, and at high concentrations, it actually flips from antioxidant to pro-oxidant. Instead of protecting your cell membranes, it begins destabilizing them. Nerve cell membranes are extraordinarily thin and delicate, among the thinnest in your entire body. They cannot tolerate that kind of oxidative disruption without consequences. Second, and this is the one that catches seniors off guard constantly, high-dose vitamin E thins your blood significantly. It inhibits platelet aggregation, which means your blood doesn't clot as efficiently. Now, if you're already taking a blood thinner like warfarin, Eliquis, or even daily aspirin, adding high-dose vitamin E on top creates a compounding anticoagulant effect. What does that have to do with nerve pain? Everything. Your peripheral nerves depend on a steady, well-regulated blood supply delivered through tiny capillaries called vasa nervorum. When your blood becomes too thin, those capillaries can't maintain consistent perfusion pressure. Your nerves get inconsistent oxygen delivery. Ischemic episodes occur at the microscopic level. The result feels like worsening neuropathy, sharper pain, deeper numbness, that horrible cold-burning sensation in the soles of your feet at night. A 2019 meta-analysis published in the Annals of Internal Medicine reviewed over 35 clinical trials involving vitamin E supplementation in older adults. The conclusion was blunt. High-dose vitamin E supplementation, particularly above 400 IU daily, showed no meaningful neurological benefit and was associated with increased all-cause mortality risk. Increased mortality from a vitamin. The recommended dietary allowance for vitamin E is 15 milligrams per day, which converts to roughly 22.4 IU of natural vitamin E. Compare that to the 400 or 1,000 IU capsules sitting in bathroom cabinets across the country. The gap between what your body needs and what many people take is staggering. If you currently take a high-dose vitamin E supplement, here's what I'd recommend discussing with your physician. Ask for an alpha-tocopherol blood level test. It's a simple blood draw. Ask specifically whether your current dose interacts with any blood-thinning medication you take. And consider whether you might get adequate vitamin E simply through food. A handful of almonds and a cup of cooked spinach covers most of your daily requirement without any supplemental risk. Your nerves need protection, absolutely, but protection delivered recklessly becomes its own kind of damage. We're about to cover the third vitamin, and in some ways, this one is the most complicated because it involves a vitamin that most seniors genuinely are deficient in. Before we get there, if you're over 60 or if you're caring for an elderly parent, a spouse, a neighbor who deals with nerve pain, this information could be life-saving. Not dramatic, just true. Share this video with them, send them the link. Sometimes the most important medical decision someone makes starts with a YouTube video they almost didn't watch. Let's keep going. Vitamin B12, cobalamin. The one vitamin almost every senior has heard they need more of. And in many cases, that's absolutely correct. After 60, your stomach produces less intrinsic factor, the protein required to absorb B12 from food. Deficiency rates among older adults run between 15 and 25%, depending on which study you read, and B12 deficiency causes neuropathy, real, measurable, sometimes severe neuropathy, tingling, numbness, balance problems, even cognitive fog and memory disruption. So where's the caution? 3 places. Pay close attention. First, the form of B12 matters enormously, and most people have no idea there are different forms. The cheapest and most common form in supplements is cyanocobalamin. Your body has to convert it into methylcobalamin or adenosylcobalamin before your nerve cells can actually use it. That conversion requires adequate liver function, adequate folate levels, and functional enzyme pathways that decline with age. Many seniors swallow cyanocobalamin tablets faithfully every morning, and their nerves never see the benefit because the conversion bottleneck is too narrow. Meanwhile, they believe they're covered. They're not. Methylcobalamin, the already active form, bypasses that conversion step entirely and reaches nerve tissue more directly. If you're supplementing B12 for nerve health specifically, methylcobalamin is what you want on that label. Flip the bottle over. Check right now if you have one nearby. Second caution, oral B12 supplements may not absorb well enough to correct a true deficiency if your intrinsic factor is significantly depleted. Sublingual tablets, the ones that dissolve under your tongue, absorb through the mucous membrane and partially bypass the stomach. B12 injections bypass the gut entirely. If you've been taking oral B12 for months and your nerve symptoms haven't improved, the problem might not be your dose. The problem might be your delivery method. A simple serum B12 blood test combined with a methylmalonic acid test gives your doctor a clear picture of whether the B12 is actually reaching your tissues or just passing through. Third, and this is subtle but critical, B12 supplementation at very high doses without adequate folate can create a metabolic imbalance that masks certain blood markers while nerve damage continues silently underneath. Historically, this was called the masking effect, and it's been documented in medical literature for decades. High-dose B12 corrects the anemia associated with deficiency, so your blood work looks normal. Your doctor glances at the panel, sees healthy red blood cells, and assumes everything is fine. Meanwhile, your peripheral nerves are still starving because the underlying folate deficiency was never addressed. The numbness in your feet gets chalked up to aging. The unsteadiness gets blamed on arthritis. The real cause hides behind a lab value that nobody questioned. Harold, a 68-year-old retired electrician in Tampa, dealt with this exact situation for 11 months. His primary care physician had started him on 2,500 micrograms of oral cyanocobalamin after a routine blood panel showed low normal B12. Harold took it religiously. His follow-up blood work showed B12 levels had climbed into the high normal range, but his feet kept getting worse, wooden, clumsy, numb from the toes to mid-arch. He tripped on a garden hose in June and broke his wrist because he couldn't feel where the ground was. It took a referral to a neurologist, a methylmalonic acid test that came back elevated, and a switch to methylcobalamin injections combined with methylfolate supplementation before his symptoms began stabilizing 4 months later. 11 months of thinking he was doing the right thing. 11 months of worsening nerve damage hiding behind a reassuring number on a lab printout. Please don't let that be your story. If you take B12, verify the form, methylcobalamin over cyanocobalamin for nerve-specific support. Ask your doctor about sublingual or injectable options if oral supplementation hasn't helped after 8 to 12 weeks. Request both a serum B12 test and a methylmalonic acid test for the complete picture. And make sure your folate levels are adequate alongside it. Your B12 and folate work as biochemical partners, and one without the other leaves gaps that your nerves will feel. Let's bring all of this together, because I know that was a lot of information. And I want you walking away from this video with crystal clarity. Vitamin B6, pyridoxine, essential for nerves in tiny amounts, toxic to nerves at high supplemental doses. Check every label, supplements, cereals, shakes, and keep your total daily B6 under 10 milligrams unless your doctor specifically prescribes otherwise. If your nerve symptoms worsened after starting a B complex, B6 toxicity should be the first suspect. Vitamin E, beneficial from whole foods at dietary levels. Dangerous in high-dose supplement form, particularly above 400 IU daily. Thins blood, disrupts nerve cell membranes at excess levels, and interacts with common anticoagulant medications that many seniors already depend on. Consider getting your vitamin E from almonds, seeds, and greens rather than capsules. Vitamin B12. Genuinely needed by most seniors, but the form, the absorption method, and the folate balance determine whether it actually helps your nerves or just makes your lab work look reassuring while damage continues underneath. Methylcobalamin, sublingual or injectable delivery if oral isn't working and paired with adequate folate. That's the combination that gives your nerves real support. Write these 3 down. Stick the note on your refrigerator. Bring it to your next appointment. Hand it to your pharmacist and ask them to cross-reference with your current medications. These small steps cost nothing and protect everything. Your nerves carried every sensation of your life. The warmth of your grandchild's hand, the texture of grass under bare feet on a July evening, the familiar weight of a coffee mug on a cold morning. Those nerves deserve precision, not guesswork. They deserve someone paying attention to the details, and today, that someone was you. You stayed through this entire video. You learned things that most people, including many healthcare providers, gloss over. That matters. If this helped you see your supplement shelf differently, I need you to do 3 things before you close this tab. First, hit that subscribe button and turn on notifications so you never miss a video. We release new senior health content every week, and each one is built to give you the same level of honest, specific guidance. Second, share this video with someone you love. Text it to your daughter. Email it to your neighbor who's been complaining about foot numbness. Post it in your church group chat. You never know whose nerves you might save with a simple link. Third, drop a comment below. Tell me which vitamins surprised you the most. Tell me if you've been dealing with nerve pain and what you've tried. I read every single comment, and your experience might help someone else scrolling through who feels alone in this. Take care of those nerves. They've taken care of you for a long, long time. I'll see you in the next one.